everyone, welcome back to my channel. Thank you so much for tuning in for today's video. If you're an old subscriber, thank you so much for coming back, and if you are new to my channel, thank you as well for clicking on this video. So in today's video, I'll be talking about medical negligence in Nigeria. Medical negligence in Nigeria is a really big thing in Nigeria. This has been happening for years now. So many medical negligence, especially in Nigeria. I'm talking about Nigeria personally because I'm from Nigeria and I've witnessed this negligence firsthand. And particularly, I'll be talking as regards to what happened to one of my course-mates recently, and also Peju. I don't know Peju, but Omolara was my course-mate when I was in the university. Before I get into what happened to Omolara and Peju, I would like us to talk about some doctors and nurses in Nigeria. There are some doctors, I'm not talking about all doctors, I'm not talking about every single doctors or nurses in Nigeria. There are some doctors and nurses in Nigeria that are just there for the money. They are just doing the job for the money. I know that we are all doing our jobs because we love it and because of money. This is our jobs and we want something from our jobs. Like we want, when we want that when we give when we render our services, we should be paid for what we have done. There are some doctors and nurses that are just there because of the money, because of the pay, and maybe from what they have heard, they really think that they will be getting paid very well. And maybe when they finished schooling and got a job, they are not being paid as they've envisioned it in their mind. As this, they are not happy with the job, and then they are transferring the aggression of not being paid well to the patient. So let's talk about the ratio of doctors to patients in Nigeria. In Nigeria, the ratio of doctor to patient is 1 doctor to 2,753 patients. Guys, is that fair? How can 1 doctor handle 2,007, almost 3,000 patients? Is that even possible? Even as we don't have enough doctors in Nigeria, doctors and nurses are still leaving Nigeria. Not just doctors and nurses, there are many able bodies, many able bodies that are leaving Nigeria. Many doctors, many nurses, many lecturers, many engineers, many able young men and women are leaving Nigeria every day because they don't get paid for their services. Last year, the federal government of Nigeria didn't pay federal workers money for 6 consecutive months. Guys, 6 consecutive months. They didn't pay them their money. I'm saying this because I know my husband used to work at a university in Nigeria, a federal university for that matter. And his other colleagues that are still in Nigeria didn't receive money for 6 months. How are they supposed to survive? How are they supposed to live? For 6 months, people are suffering in Nigeria. The federal government is not, it was in those days that you'd be like, oh, I'm a federal worker. I'm a federal worker. I know that my job is secured. I'll get paid every month. Federal government does not owe people money. That was in those days. Now, even the federal workers are suffering. They are suffering. They are not being paid. They are being treated anyhow. So how do you expect these people to still work diligently? So the main reason I'm doing this video is to get justice for Omolara and Peju. So what happened was that I think Omolara had ulcer, and then she had an attack. So she went to the hospital. Was it an attack or she wasn't feeling well? So she went to the hospital, and when she got there, she was admitted. From what I read from the story, the person that was there, the lady that was there with her, from the story she said, from what I read, she said she got admitted into the hospital, and then sorry guys, I'm not good at telling story, but I think you guys should be able to get the gist. I'll try as much as possible to be coherent because I'm really angry. I'm really bitter now. So if this video is all over the place, I'm really sorry. So she said Omolara wasn't feeling well, so she went to the hospital and she was admitted. So while they were at the hospital, they treated her, and even while they were treating her, she wasn't getting better. She said they came and they injected her in her veins as if they are putting drip. And when they want to pass drip, you know, they will look for your vein here. So she said they injected her in her vein, and I don't know what like she said her condition got critical and she wasn't able to talk. So she said the other doctor came in. Apart from the it was a different doctor that was taking care of her before, and then another doctor came in. And can you guys imagine, the other doctor that came in said the first doctor that attended to her didn't know that her condition was critical. How won't you know that a patient condition is critical? So they got oxygen because at this point she couldn't breathe herself. So they brought oxygen so that it will help her to breathe. And then she said they were now asking her about Omolara's medical history. Please, when you get to the hospital, what will the doctor first ask you when you say you're having headache, or when you go to the hospital or to complain? What is the first thing that a doctor or a nurse is supposed to ask you? Are they not supposed to ask you about your medical history? What has happened to you? Are you battling with this? Do you have any medical history? Do you have any thing? You know, ask those questions. So why are they asking the friend? Is the friend Omolara? And the girl also stated that Lara has been using this hospital since 2019. So why are they asking the friend? So she has been using this hospital since 2019. You guys didn't know her medical history. Things got really critical quickly. So the doctors decided to refer them to Luth. She said she noticed that the doctor was being careful because he wrote a referral and he cancelled the first referral, and then he wrote another referral. And that she noticed that the doctor was being very careful while writing the referral. Why are you being careful? Why are you being careful? Because something has happened. Because something has happened or something is about to happen. You guys know everything. And why will you allow, when you know that things are starting to get out of hands, why won't you be fast with your actions? Why did you let things get out of hands before taking action? That was why you were being careful with that referral letter. That was the reason why the doctor was being careful, because things has already gotten out of hands. So Otibosori now, Otibosori. So that was when he wrote the referral and he was being careful with the referral. And then the girl said when they entered the car that was taking them, I don't know if they eventually got an ambulance, that when they got into the car, one of the nurses came to put oxygen on Omolara again, and then when she removed it, she told the doctor to take her to the hospital on the highest speed. And when they got to the hospital, she was declared dead on arrival. Maybe Omolara had even died before taking her out of the hospital, and they are just trying to wash their hands off it because they knew what they have done is just pure negligence. They knew they didn't try. They knew they didn't do anything to help her. That was why they had to refer, and that was why the doctor was being careful when he was writing the referral letter. I'm being pained because Omolara was a very hardworking girl. She has 2 businesses where she sells perfumes, and the other one where she sells small chops. She sells chin, she sells plantain chips. She was an hardworking girl, and she was even working for Lagos State. I don't know Peju personally. It was because of Omolara's incidents that I got to know about Peju's story as well. So Peju had fibroids. So she had gone to the hospital to get her fibroids removed. So when she got to the hospital, she was asked to go for some tests, you know, to check her organs and vitals, and everything was okay, and it was good for her to go for the surgery. So Peju went for the surgery and they did the surgery. So after doing the surgery, Peju started complaining about abdominal pains and discomfort. She thought it was due to the surgery. If you have undergone any kind of surgery, it is normal for you to have discomfort, some kind of discomfort. So she thought it was because of the surgery that she was having abdominal pains and discomfort. So the next day, they told her the pain didn't subside. The abdominal pain she was having didn't subside. So the next day, the doctor told her, the doctor told her husband to get B positive blood, for blood transfusion for her. So the husband went looking for B positive blood, and he got 4 pints of blood. They put her on blood transfusion, and her blood pressure was also going down really fast. So the husband, being, you know, you would want to look for help anyhow, anywhere. So the husband called a specialist in UK. From the husband's explanation, the specialist told the husband to tell the doctors to take her back to the theater immediately because she has internal bleeding. But this doctor, they turned down the suggestion of the specialist in the UK that they will take her for CT scan or something the next day. Are they not supposed to look for immediate solution to what is happening to her? They turned the request down of going back to the theater, and they said to her husband that they think her kidneys were not functioning well, and she was okay before the surgery. She did her vitals, they checked her organs, she did tests, everything was okay pre-surgery. So what happened to her kidneys post-surgery now that they are not functioning well? What happened to Omolara and Peju were just pure negligence. So they sedated Peju while her BP was terribly low, and also clipped her eyes shut. And the next day, she was pronounced dead. So after Peju's death, an autopsy was done on her, and it was confirmed that she indeed died due to internal bleeding. Do you know, Nigerian doctors are I've said some from the beginning. You know, they are so full of themselves that some of them, when they want to treat you and you are trying to know everything, you want to know things, how things are going, why they want to do this, they will be angry. They will be furious. They don't want to explain. They don't want to say anything. This thing is going to my body. Why wouldn't you want to explain to me? Why wouldn't you want to tell me? This morning, I took my daughter to the clinic. Before the nurse put anything in her body, she told me she would take this injection, that injection. She explained everything to me. And also, there is even a pamphlet for you to read. So you have full knowledge of what is going into your body or your child's body. For crying out loud, why won't you explain to people what? I don't even know what they injected into Lara's. I don't even know what they injected into Lara's vein. Like, they treat human like animals. Like animals. Like, why? I couldn't take it off my mind when I saw the story. And I'm just trying to share this with you guys. I just thought I have this platform, although it is still small, but it is something I have on 1,000 plus people here. And please, you guys should share this video. Let it get to the right people, and we want justice for Omolara and Peju. Please, guys. Doctors administering tablets and injections to patients without asking them to go for tests, without without knowing what is actually wrong with the patient. Without actually knowing what is wrong with the patient. You just administer, you just think in your head, oh, because you have headache, because you have back pain, because you have migraine, because your neck hurts, okay, that means this is what you are going through. Then you administer drugs for them, you give them injection without actually knowing what is wrong with them. Without asking them to go for proper checkups, to go for this test. Even if you are suspected something, is not in your position to just administer drugs, administer injections to them. It is for you to tell them that, okay, I think this is wrong, this is what is wrong with you, but go for so test. When are these medical personnel going to learn? When are they going to start working professionally? When will they stop working based on their own imagination? When will they stop working based on their own discretion? When? This is unfair. They take people's life, take people's happiness, take people's joy. You don't work on your own discretion. You don't work because you feel you've been working for 20 years, you're experienced in this, you know those are the symptoms that when you are this, these are the symptoms you get, and as such, I will administer without asking the patient to go for tests, scans,